Legal action is being taken against Jeremy Hunt and the Department of Health over their proposals to restructure the NHS. The Independent can exclusively reveal plans have been tabled to convert the NHS into a public-private enterprise, which critics suggest is based upon the U.S. private health insurance-based system. Senior health professionals and campaigners have now come together to take legal action and demand a judicial review, to ensure parliamentary scrutiny of the proposals. Under NHS England's new plans, the boundary between health and social care would be dissolved and new systems and structures would allow alternative funding sources, ultimately leading to the creation of new healthcare overseers called Accountable Care Organisations (ACOs). ACOs would permit commercial, non-NHS boss to run health and social services. They could be awarded huge contracts to manage and provide whole packages of care, allowing the ACOs to either provide the NHS service themselves or subcontract it. This means ACOs will have control over the allocation of NHS and taxpayers' money, but their accountability for spending it and their obligations to the public will be under commercial contracts, not government statutes. Solicitors representing prominent NHS campaigners have now contacted Mr. Hunt to inform him that they are seeking a judicial review in an attempt to ensure Parliament can scrutinise the proposals. They claim the Department of Health's consultation process was limited, inadequate and unlawful due to the lack of national consultation or parliamentary approval. Clive Lewis MP has endorsed calls for a judicial review and said the plans were an attempt to erode and meddle until a US healthcare-style system was in place. I, like many, feel increasingly alarmed by what is happening to the NHS. It's perilously threatened. Jeremy Hunt's reply to me in Health Questions indicates that he feels he has the right to change fundamental structures without reference to those who work in, use and care about the NHS, without an Act of Parliament and without explaining properly why these commercial organisations are needed and how they will improve care, Mr. Lewis told The Independent. He's wrong. If we don't stay vigilant, the Tories will erode and meddle until they get the US healthcare system they appear to have planned. The Labour Party conference voted unanimously to oppose ACOs, and we must fight Hunt and Simon Stevens, CEO of NHS England, every step of the way until a Labour government can reinstate the NHS as a publicly provided and funded service, Mr. Lewis added. Dr. Colin Hutchinson, Professor Alison Pollock, Professor Sue Richards and Dr. Graham Wynyard are all working together to put the case to the Department of Health. Professor Pollock, a BMA Council member and co-author of the NHS Reinstatement Bill, said the proposals were an attempt to Americanise health care in England and that the NHS was progressively being dismantled. Our NHS has been an international model for countries around the world for a health system that represents fairness, efficiency and freedom from the fear of illness. It has provided health care for all free at the point of delivery through public funding, public ownership and public accountability, Professor Pollock told The Independent. Its popularity has endured since 1948 and is a symbol of all that is decent about Britain. However, it is being starved of funds and progressively dismantled and replaced with corporate structures known as accountable care organizations, which will facilitate the introduction of American-style healthcare systems. These latest proposals are the tipping point in steps towards the Americanization of England's healthcare. The government has not only failed to consult the people of England about its plans, but it has failed to lay its proposals before Parliament. In so doing, it is acting beneath the statutory radar in attempting the Americanization of our healthcare and this fundamental reorganization by stealth. We call on everyone to support this legal action against the Secretary of State for Health, to ensure proper national public consultation and parliamentary oversight and scrutiny, she added. The Independent has contacted the Department of Health for a comment. The news comes as NHS bosses reportedly issued a cry for help after years of funding cuts. NHS and social care leaders have written to Chancellor Philip Hammond to demand an increase in the pace of investment and an end to public sector pay restraint. The heads of groups representing the entire NHS, medical royal colleges and a host of UK charities have co-signed a letter to the Treasury in advance of the upcoming budget. It follows assessment from regulator the Care Quality Commission (CQC), which said that frontline services are now in a precarious condition. The letter says even if the government were only to stick to its current commitment, we believe the remaining £5.2 billion should not be reserved for the last 2 years of the Parliament. It should instead be brought forward now to address significant current challenges. More about Jeremy Hunt, NHS Department of Health reuse content.